So HIPAA was actually designed to help people move personal information around, right? So that, a given hospital couldn't hold your records hostage or whatever, and, ensure portability of medical records, right? One of the things that was an adjunct to the HIPAA legislation, though, was you need to be able to protect that information as you're moving it around, right? So it was intended to make it so that people could take medical records from one service provider to another, but it came with this, set of regulations around, if you're going to do that, how do you safely and securely store and exchange that information, which is where the regulation comes in. The other challenge is most of our customers aren't directly regulated organizations as it relates to HIPAA. So they might be a B2B SaaS company that is supporting health, but they're not a healthcare provider. They're not doing healthcare plans. They're not a clearinghouse. They're not necessarily a business associate, but they have to comply with HIPAA because anyone who they are selling to that falls within that bucket requires their service providers to effectively be HIPAA compliant. So it's one of those kind of cascading things. So HIPAA has got safeguards around administrative controls, physical controls, and technical controls of this data, right? And it's a classic older standard. So it's fairly explicit, like you have to run antivirus software, you have to have your data encrypted, those sorts of things.